over to our founder, Dr. Randall Maxey, to take us to the next level.
Good afternoon on this beautiful Super Bowl Sunday. At least it's beautiful out here near the Super Bowl. I don't know what it is on the East Coast. As Dr. Barber said, you're on your own. We've noticed over the past few days that the economics of the United States has prevailed. And almost all of the states are dropping their mandates for masks. And we're very concerned that many of us, most of us, are still very vulnerable.
Carl Brooks.
If you have not, hold on one sec. Simon, I'm going to have him send you the thing. Carl, we got the. Okay. So most of us are vulnerable. The most vulnerable people are still having trouble. I'm told that there's a new drug out, which is not a vaccine, but in fact, a combination of two immunoglobulins, and it's called Shield by AstraZeneca. And the United States government ordered 1.3 million doses of that. 500,000 have already been given out. The remainder of the 1.3 are due sometime in April. And that is not nearly enough to go around to vulnerable people. And in fact, I only recently heard of it in the past week. And I bet many of the regular people who aren't health professionals haven't even heard of it yet. So how are we going to protect ourselves? So we want you to know, like Dr. Nabert says, you have been adequately prepared. We know common sense. We know that there's information that we've gotten over the past 2 years, and you need to do what you have been doing all this time to stay safe. That also means you need to be knowledgeable. You need to be on the CDC data sets and find out ahead of time what you are supposed to do. So without any other information, Barbara, let's talk about the statistics, and then let's go into our discussion with Dr. Jocelyn Hines, Dr. Walks, Dr. Nabert, and myself.
All right, Simon, could we have the slides, please? So we are going to review the statistics taken from the CDC webpage for yesterday. As of yesterday, the 12th, there were, since the beginning of all of this commotion, as the old folks would say, we have had 77,516,009 reported cases. Of those, 12.4% are attributed to African Americans. New cases are reported at 170,582. Total deaths, 915,425. And 13.8% of those deaths are attributed to African Americans. And the daily death toll for yesterday was 2,668, which, if we're going to try to get any kind of good news out of all of this, that's good news. It's down from where it has been for sure. Next slide, please. But I got some new takes on the situation as far as vaccinations are concerned. I'm so happy that I can now report on this. So as of yesterday, we had, of the CDC definition, fully vaccinated, which is 2 doses of the 2-dose or 1 dose of the 1-dose vaccine, 213.7 million, or 64.4% of the total US population in that status. And of that group, 10% are attributed to African Americans. Now, this is the new news. We are now getting data reporting on the so-called fully vaccinated who have had their booster. And of those individuals who are fully vaccinated and received their first booster, in the US population, 91.4 million or 44.1% of those eligible have gotten their first booster. And of that group, 8% or 6.5 million of the 91.4 million are attributed to African Americans. Now, there's some takeaways. There's some takeaways on this. And the most notable one is we are not protected. As a people, we are not really protected. And we need to continue to work on getting the word out, especially as we move into a state where there is no, where limited, if any, mandates are in place requiring people to put on their mask. We need to take note of the fact that if you're not vaccinated and had your booster, you are in a situation where you could get infected. The other thing that came out in the news this week from the CDC, which we will certainly follow closely, is that Pfizer is reporting significant drop in protective antibody levels in those who have received the booster 4 months or more after receiving the booster. So we will see how this plays out, and I'm in that group. I'm at the tail end of my 4th month after getting boosted. We are not as protected after the 4th month as we were before. So it's even more important to remember that we've got to use all of the tools at our disposal to try to protect ourselves. And with that, I'll turn it back over to Dr. Maxey.
Well, good. And we're going to have a very lively discussion about this. 2 weeks ago, I made an announcement that I was going to get my second booster. And I did. And as it turns out, in the literature is saying that people who are immunocompromised, and most people who have chronic diseases, whether it be hypertension, whether it be diabetes, whether it be HIV, AIDS, or maybe obese, or many people who are just Black, may be considered for a number of reasons immunocompromised. And so I went to the place where I normally get my vaccine, and that was on the program, that if you fit into certain categories, especially over the age of 65 and have some of those diseases, you can and should be considered to get a second boost. And not only that, the criteria seems to be, instead of waiting 5 months after your last shot or booster, you can do it as early as 3 months. So we can discuss that. And I know Dr. Ivan Walks is anxious to jump in on that, since he's in charge of the task force for some of the information that we give out. Now, we know we're tasked to give vetted information. But I can tell you that with all of the mandates going, with the CDC in confusion, there is not all vetted information. So let's discuss some of those. And Dr. Walks, if you want to jump in there, that's good.
Dr. Maxey, I will jump in, and I will not jump on you this time. After jumping in and jumping on you the last time that you mentioned getting your 4th booster. I will just tell a personal story. This goes back to when the booster shots were beginning to be made available, and they were beginning to be made available for immunocompromised folks. And I couldn't wait. I rushed out to one of the major drugstore chains and filled out the paperwork, and was ready to get my booster. took my wife with me. May not have been the best plan because we got there and they had very specific criteria. They were not just boosting Black people. I couldn't just go in there and say I was immunocompromised. I had to fill out something that said what particular medicine I was taking that compromised my immune system, what specific illness I had. And so I just want to say to folks that, and I had a less than warm and friendly conversation with the people at the pharmacy, and I left without a booster shot. A few weeks later, stuff was updated, and I was able to go and get my booster. So everybody has a better attitude than I do. And I'm probably the only angry Black man anybody knows. But I have a tendency to get angry when I don't get what I want. And I think it's reasonable. I thought it was reasonable for me to get a booster given age and everything else. So I'm saying all of that to say, let's be careful about going someplace and getting unhappy and disappointed because they're following guidelines set out by CDC or whoever they're following guidelines set out by. And we're not, we don't meet whatever guidelines they say we meet. So that was my concern when we talked about a fourth shot, which would be the second booster, Dr. Maxey, is that we are making sure that the information that we give is not only vetted from a scientific perspective, but also useful so that people can act on it. I'm really big on getting smarter, but I'm even more interested in information I can act on. So maybe Dr. Hines is usually the smartest and the quickest with the CDC website and what the current guidance is. But I want to be careful that I don't send me back to the pharmacist being angry because I went into a major drugstore chain that offered boosters, but they said I didn't meet the criteria.
Here's
Does
my
that make it clear?
No, my concern is that I don't believe the current information we're getting from the CDC is the most current information and even may not be the up-to-date information and may not be the right political information during this period of transition. The CDC is actually at odds with some of the states, and the states are at odds with the CDC. When you talk with some of the experts around the world, they're both at odds with both of them. So I'm not sure just following a guideline is the only way to go right now when you're on your own. I'm raising that question of what is best for you. Where I went was a place that is made for Black folks especially. It's called the Kedron Center, directed by Dr. Jerry Abraham. And there was a whole different understanding of what I needed when I went there. So I'm saying that we have to be creative and not just follow a printed paper at all times. Now, generally that's a good thing to do, but if you're in danger, you may have to color outside the lines a little bit and get there while the stuff still lasts. That's my concern, Dr. Walks.
Dr. Maxey, no argument with any of that. My focus is what's available to us. And if I was there near Kedron with Dr. Abraham, I'd be happy to walk in there and talk with Dr. Abraham about how he's doing things. I grew up in LA, I went to USC. I'm happy to come to LA anytime. But where I live now, we don't have anything like Kedron. And because we serve a national audience, I want to make sure that people know that whatever we tell them on the Black Health Trust, I think it's important for us to recognize that there's such a broad diversity of folks on the Black Health Trust call and a diversity of resources available to folks. So I just don't want anybody going out and getting into a situation like I did, where I had to remember that I used to live off of 39th and Western, and then calm myself down when I thought I was going to get something that made perfect sense to me.
Dr. Johnson-Hines, what do you think?
So I think that clinicians who have access to the research environment or the academic environment are oftentimes privy to information that is more cutting edge, so to speak, and oftentimes have a different mentality when it comes to new, novel, experimental treatments, thought processes, that kind of thing. But the same thing translates to us as regular people. As regular people, some of us are willing to be the first people out there. Some of us want to be in the middle of the road. Some people aren't going until the very end. So when we're talking about things that are in, research phase, speculation phase, you're going to find, as Dr. Walks was alluding to, some people who aren't willing to go out on a limb to give that fourth dose, who may not even have the authority to do so based on their contractual agreements, their company protocols, all of those kinds of things, especially when you're talking about people who are employed. Now, when we're talking about from the individual point of view, you should always want to be, you're always going to need to be an advocate for yourself with whatever information that you have. But I think the underlying point is, if you come in with something new or novel that the clinician or pharmacist that you're speaking to is unaware of, there's a space for, here's this information, I'll come back, I've left you with this, I'll come back in a week. You think about it or whatever, here's my expectations. Because sometimes you can't have a conversation with somebody if they don't know what you're talking about, right? That's not a fair information balance. So sometimes there is a space where you may have to be a little bit patient to get people to come on board. But we've seen this along the way with, for example, like vaccinations well before COVID, zoster vaccination, all kinds of things, right? Where the guidelines said that you couldn't give it before a certain age, but you had individuals who needed, you couldn't get it before 65, but I've got 60-year-olds who need it. Like, these things change in our dynamic. I think we have to be cautious about abandoning what has been a model for standard of care for the general public, right? Public guidance is just that. It's public guidance. And as we say on this show on a regular basis, you need to talk to your individual clinician and people who know your individual circumstances to see how the public guidance applies to you as an individual. But I think we want to be clear in saying here, we're not suggesting that you just go off and do your own thing, right? Because then what are the parameters on do your own thing? We saw that. We saw that with ivermectin. We saw what happens when people just go off and do your own thing. And I think our goal here is to try to avoid that, right? Like, give you information that you can, so you can have an informed conversation and you and your providers can make informed decisions together, which is what I imagine that when you went to the center that you were referencing earlier, you and your clinicians made an informed decision about what was best for you.
Absolutely. Dr. Barbara.
Well, I wanted us to have this conversation today because, and I'm really in that same space that Dr. Hines was in, as public guidance is changing, ever changing, we need to be that self-advocate and find the path that is best for ourselves. When we are employed at a place and you live in a state that has not been supportive of science all along during this pandemic, and there's several that would fall under that category, you may very well find yourself in a workplace where you're not allowed to wear a mask. You may work in a bar and the owner of the bar says, y'all can't wear masks. You can't offend my customers. So we have to figure out, or, that's a fairly small segment, but let me broaden that. Let's think about the school teachers now who are going to be in the schools with children, I am afraid most of which are not going to be immunized, and they're not going to have on masks. What are these teachers to do? People who work in factories that have production lines, I think you know the kinds of companies I'm thinking of, may not be supportive of masks and have had no mandate for their employees to get vaccinated. What are you supposed to do? And then I heard on the news yesterday that Walmart, which is a company that interfaces with millions of people, is no longer requiring a mask. And I would say that a large number of the people who trade at Walmart are in vulnerable populations and may or may not be vaccinated. What are the choices that we need to make going forward? We unfortunately have no control over the decisions that have been made, but we have all the control over what actions we personally take. And that's what I would like for us to really focus on in our shortened program today.
And this brings me right to where I think we ought to be. So today is Super Bowl Sunday, and all of a sudden you are a player for either the Bengals or the Rams. And the chief executive officer of the NFL says, we're going ahead with the Super Bowl, but nobody can wear equipment. Nobody can wear a helmet. Nobody can wear shoulder pads or any pads. So you go out there and let yourself get hit by one of these 350-pound monsters. I personally would not play. So to me, you're on your own means that you have to make a decision many times that will counteract somebody else's bad decision because it won't provide you with protection. That's what I mean by you're on your own. Just like Dr. Neighbor just said, Neighbor Stevens, you have to make decisions that protect yourself. Now, you do have the decision to go and play and make that $15,000 or whatever they make for playing in the Super Bowl, or you may decide to keep your bones unbroken. But in either case, it needs to be a decision that you personally advocate for, whether you want to work for Walmart anymore, whether you want to work in the bar anymore, but it's game time and you have to make a potentially life-saving decision, and it may go against the grain and there may be an unseemly cost to it, but you're measuring that against your and your family's life. That's the discussion. So, Dr. Wilkes, I think given that much of this has to do with people's thought process and you're the thought guy, please see what we have amongst us to discuss.
So Dr. Maxey, I appreciate you calling me the thought guy. I have been accused of acting without thinking in the past many times. Let me say this about that. I think the importance of advocacy, the importance of us being thoughtful. You call me the thought guy, right? It's important for us to be thoughtful about how we are conducting ourselves, how we're exposing ourselves to the threats that are out there, and to broaden the conversation. That includes all the things that we do. It isn't only whether I'm going to get another booster, whether I'm going to wear a mask. It's also how many times a week am I going to eat some fast food that's unhealthy? How many times am I going to set an alarm on my phone or on my watch so I can get up and get some exercise? There are a lot of things that we have to be thoughtful about as we're thinking about our overall health. You can't continue to be 100 pounds overweight and you have all your shots and your booster and think that's all you have to do. So I think it's important for us to broaden the conversation to being thoughtful about our health and to being advocates for our health. And I think we may be on our own from the perspective of what these various governors are doing in different states and what different school boards are doing within those different states, what the local school boards are doing and what the big companies are doing. We may be on our own from that perspective, but from the perspective of getting good information from organizations like the Black Health Trust, from the perspective of us having folks that we can call and talk with, like you can go and talk with Dr. Abraham at Kedron. I think I don't want folks to think that because the guidance may be changing, because it's been changing all along, because the political landscape is continuing to be less supportive than some of us would like it to be, because it's been kind of weird all along, that we are on our own as individuals. I think we may be on our own as maybe not in sync with some of the local governments and guidelines and organized entities like CDC. But I don't want folks to think, and I think that's what the don't panic part of your title for this week's message is. The don't panic part is you do have the Black Health Trust still. You do have places like Kedron you can talk to. You do have your provider you should talk with. And I want folks to feel comfortable that those are meaningful and those are real, and we can get good help and we can get good advice.
Let me ask a question, Dr. Walks. What word is in the direction of panic, but not panic, but concern? Like often I used to watch monster movies and they say there is no Godzilla, don't panic. And next thing you know, Godzilla is stomping all over the city. So I don't want to suggest people panic, but I do suggest that we might want to be hyper aware, hyper concerned. What word would express that?
Dr. Maxey, every time I think about panic, the word that comes to my mind is prayer. There's some. I'm being completely transparent. For me, I don't believe that I'm alone in the middle of what's going on in my life, no matter how unsettling things get to be. And I think it's possible for us to have, if you're talking strictly medically, before you get to panic, typically there's a period of anxiety. And anxiety can sometimes be useful because it helps you to be hyper aware and hyper alert. And so to go back to that part of your question, yes, before you get to panic, there is a recognition that maybe I'm in an unsafe environment or I'm in an unsure environment. So I'm going to heighten my awareness. I'm going to pay attention to my surroundings, and I'm going to look at what my resources are so I can be best prepared. One of those things for me happens to be prayer. Primary on the list happens to be prayer.
Yeah, and also in the area of common sense, and maybe Dr. Nabert and Dr. Hines can comment on this. In the horror movies that I used to watch, there's this basement, and you just saw Dracula go down in that basement, and you've only got a candle. And you light the candle, and you walk down the steps where Dracula is. That is not common sense.
These are, well, hold up. These are not movies with Black people, right?
Of course not.
Okay, I just want to be clear.
And my
we don't go down there.
My reference is I had to go to one of the U.S. territories where the rate of COVID infection was above 42%. And I didn't want to go, but I was ordered to go. And I needed to make sure that I had as much protection as I could, whether it be a face mask, whether it be a shield, whether it be my vitamin D. So I had to be hyper alert and not do something that was totally going to get me killed. And I'm just saying that I wanted to make sure our audience ups the ante to make sure you know that these people that are your neighbors and co-citizens are putting money and so-called freedom above you. Any of us, if we have brothers, sisters, and children, are not going to do anything that puts them at risk unknowingly. But we see that these people don't care that Black communities may be more vulnerable. They say, well, I got to make my money no matter what. You have to die. That's the way I'm reading it. I'm sorry, but that's the way I see it.
Well, I wanted to take it down another path of don't fall for the I'm trying to clean it up. Don't fall for what you're being sold. Now, I have noticed that there is a lot of, as everyone I'm sure has observed, there is all of this impatience and intolerance of making adaptations for COVID. And there is all of this fatigue about COVID. And the flip side of that is the accelerated attempts to say and act, more importantly, to act like things are back to normal and that we can go about doing things really the way we used to do them. I really want to get the message across. Don't fall for this. Don't fall for this. We are not back to normal. We don't know when we will be back to normal. And there are things that you need to remember to do to take care of yourself and your loved ones.
Is that true that you're saying what may be normal for them is not normal for us?
I don't even want to nuance it. I really want to just say, don't believe and buy into the propaganda that you are hearing that everything is back to normal.
Is propaganda the same as okie doke?
I'll chime in and say that I'll be honest. We're not going, like, there's no reason to go back to all the way to before, right? What in the world is wrong with washing your hands, right? What in the world is wrong with having hand sanitizer every 3 feet, right? There's nothing wrong with that. What in the world is wrong with keep your sick self to yourself, right? And don't come around other people. There are some things that we really shouldn't go back to, right? Like, because they weren't doing us a service in the first place. For many of us, we got to experience during the true lockdown just how germified we regularly are, because so many people had less sickness, less sinus infection, less colds, less all kinds of contagious illnesses when we were truly at home. And I'm not saying that the point is go back to being on lockdown, but my point is it should highlight for us there's some things that we weren't exactly doing right before, and we don't have to go all the way back to where we were before, to pre-COVID. Like, there are some things that should go forward with us in the long haul. So in my mind, there's just going to be a new normal. We shouldn't. There's no reason to not have soap in bathrooms. Like, come on.
So Dr. Salifu on his presentation a few weeks ago showed that for Omicron, when you talk, sneeze, or cough, that those small droplets become aerosolized and may go as far as 30 feet. And we're still, in many cases, hear the news talking about 6 feet. So that's the part of being hypervigilant. I'm told that, and I don't know much about measles anymore. I'm not a pediatrician, but I understand that COVID is as infectious as is measles. Now, people have hyped the fact that you may not get as sick. However, for many of those who do get sick, it is still deadly. And I have consulted on a number of cases around the country of people who, because of their body habits, their high BMI, their diabetic state, or a number of other things from Omicron, have been in ICU, have developed severe cytokine storm, and several have died. Some needed dialysis. Some were even dialysis patients, but they were immunocompromised. And we know that obesity leads to an increased ability to have a severe cytokine storm, which can wipe your lungs out and kill you. So I think Dr. Hines is exactly right that we need to be more degermified, if that's I like that word. And we do need to use common sense and know we're not going back to where we were. And the original place we were wasn't good anyway, where we didn't keep ourselves clean, didn't keep ourselves as healthy. I'm speaking that as a large group, not any individual. But I think that the advice that we gave early on in the Black Health Trust about cleanliness, about the way you eat for health, and the way you protect yourself from other people and yourselves. Are there any items in the chat, Dr. Barbara?
There's some references that different people have made, links, I should say, that have been provided. And I think I answered the question that was asked by Ms. Hall. And if that's not enough of an answer, Ms. Hall, let me know. I wanted to kind of wrap my thoughts up. And you mentioned Dr. Salafu. I actually heard Dr. Salafu's boss on TV yesterday, Dr. Wayne Riley. And he was asked the question, what does he tell people since there is flux in the guidance that's being provided, and certainly flux in the behaviors that are being exhibited by people, by the public at large. And he said, and so what does he tell people, what's the best way to protect themselves? He says, I tell them vaccinations. He said, and I sum it up like this, and I'm quoting Dr. Riley. Vaccines keep you out of the ICU. Vaccines keep you off the ventilator. Vaccines keep you out of the hospital. And most importantly, they keep you out of the funeral home. I think that sums it all up.
That's good. That's good. What else is out there? So in terms of what we wanted to talk about in terms of diet, nutrition, Dr. Walks, you started down that line. Have we got any more suggestions? I want to reiterate what we recommend from the Black Health Trust in terms of dietary approaches to good health. I think that can't be emphasized too much. Or Dr. Hines, Dr. Neighbor?
I would say, Dr. Maxey, and then I think Dr. Jordan would like to make a comment as well. So maybe we can unmute Dr. Jordan. I would say that our focus on the Black Health Trust has, for all of the right reasons, been on COVID. In addition to COVID, we've also focused on those other things. We had someone on the Black Health Trust telling us to, move around and get up and exercise, and was doing it during the program. We've had people talk about good nutrition. I think there's an opportunity for us to look more comprehensively than we ever have before at our health. So many things aren't fair, right? We do live we're more likely to live in food deserts. We're more likely to not have access to some of the healthcare that we need. And Dr. Hines has talked about federally qualified health centers, maybe in certain communities and all of that. At the same time, there is still so much that we can help each other to keep our common sense focused on, so that we are as healthy as we can be. In the middle of all of that, while we're fixing all the problems, while we're trying to get our voting rights and elect the right people and let people know that in the middle of all of that, there are things that we can do as individuals. So, and parents and influencers in our families to have healthier families and healthier communities. I'm sorry, Dr. Jordan, I thought I was going to say one sentence and I said about 20.
That's all right. No, but I think we forget about AIDS. In the early days of AIDS, we had charlatans in many cities, one in Washington, D.C., I know of, one in Los Angeles. Dr. Sebi, he was charging people $30,000 to cure, and nobody got cured. In fact, I had one patient take the stuff, we put an NG tube down his throat, had it analyzed, it was pure olive oil, took it to the state attorney general. They chased him out of town for a while, but he came back. My point is, people, this part is nothing new. People will try to do things. But at the same time, what is missing in our community Still, too many Black people do not have a primary care doctor to go to. That is a big problem, period. And I hope we can take some of this time between now and whatever else is coming down to encourage people to get a doctor. No, we've had over 8,000 patients at Oasis, and we only had 3 people referred by a primary care doctor. They come in new. If they have high blood pressure, we find it. If they're in early renal failure, we find it. But they don't go to doctors. Too many young Black men, the only doctor they have been to in the past 5 years is a BD clinic. That's our problem. Now, maybe if we're in Mississippi or rural Alabama, I can understand that. But in Los Angeles and Washington, D.C., there's no excuse. There are enough doctors, Black and white and otherwise too, for people to go to, period. I think that's an ongoing problem that we need to deal with, try to encourage people to have someone. That's a structural problem that we don't do. And that's what's going to kill us, because we don't have anyone to go to. I think we need to really deal with that. And as the other doctor said, I wouldn't want to go back to the old landmark, that sometimes we can take a little few steps back, but not go back there. There's nothing wrong with hand washing. There's nothing wrong with doing things. And there is nothing right with being 2, 3, 4, 500 pounds overweight. And we don't say it enough. You look like a hippo in drag. That makes no sense. It isn't helping anyone when we do that. And we need to stop telling Cousin Bessie that she looks good. She does not. And we can eat 1 plate of pork chops rather than 5. I mean, that's something we're doing.
Dr. Jordan.
There's no reason for that. I have them in my, we just lost Denise. She weighs 740 pounds. There was no reason. My response always, if you're gonna walk naked through a jungle, then you have a reason to be that fat. Because if one of those poisonous snakes bites you, that fat is the only thing that can save your life until you can get you to the hospital. So you're walking down the street in Los Angeles, there is no reason to be weighing 700 pounds.
So Dr. Jordan, let me step in. I think your point that we need to optimize our health is a good point. I do think that there are a lot of challenges that folks have that we don't see. Mm-hmm. And so, yes, we don't want to keep telling our family members who could be healthier, whether it's from being obese or from smoking a cigarette. We don't want to ignore them and say everything is fine. At the same time, we want to make sure that we try to give them an ear to understand what may be happening. Sometimes someone has been, and I'm not making any general diagnostic statement, but I've met people who are trying to hide behind a lot of body mass because they've been abused when they were young. They've been taken advantage of in one way or another. Yes. There are people that have, as you know, that have health conditions that have them gain weight and have central obesity from all kinds. There are a lot. So the point I want to make is I don't want anyone to leave. And I know you didn't intend to do this, Dr. Jordan. I don't want anyone to say that we are doing body shaming. I think that's the new term that we use. At the same time, we want to make sure that we are available when one of our family members is doing something that we think is unhealthy for them, and they can come and they can talk to us about it. Because the other place that goes is the substance abuse epidemic. And I know if you're dealing with people the way you are, Dr. Jordan, that's a huge issue. We have a lot of folks hiding from the reality that they're struggling with substance use disorder, and those numbers are shooting up completely off the charts in terms of the people that look like many of us who are dying from overdoses and who are having their lives ruined with substance use disorder. So sometimes we don't use exactly the right words to make the point we want to use. I'm guilty of that all the time. I think we have to just continue to look deeper. When we see someone whose lifestyle or life choices may be unhealthy, let's make sure that we're looking deeper to see if there's a place for us to step in.
I think that's an excellent point, but let me go a little bit further with you and Dr. Jordan. First of all, in recognition of Dr. Jordan's plea for everybody to have a primary care doctor, what I'd like to do is for us on the Black Health Trust, we'll create a list of physicians that we know in every city so the people can write to the Black Health Trust and we can make a referral. Or you can choose from a list that we'll try to collect with our partners, the National Medical Association and other friends that we know, so that we can have a list of people that you could at least be in your area or your county, if not your exact neighborhood. I think I read a statement earlier today that the more primary care physicians people have, the more vaccinations that you're going to have. And I think that's very important. But let's talk about the issue that Dr. Walks raised of body shaming. I think that is something we had to be very cognizant of, but to be very cognizant of people using substance abuse. But we also, I think, have to find a very direct and penetrating way to approach people who have both mental issues, but that mental issue can also lead to your early demise. And we have to find a way to both protect their mental status, but also protect their life. How do we do that, Dr. Walks?
But that's where having a primary care doctor can help. 64% of my male patients that are ACEs give a history of being molested and raped in childhood. 88% of their sisters have the same thing. Dr. Walker is right. There's a reason that all of us do what we do, but that isn't helping. So a lot of people will hide behind their weight. Very often, when you see someone at a historically Black college and you look at the choir and half of the men are just massively overweight. Yes, there's a reason. There's a reason. We all do what we do, period. But that isn't helping just to say, I'm not going to shame him. We have to do something to help him. And to me, the main thing, hopefully if you weigh 700 pounds and you go see a doctor, he's not going to ask you to bring him some of the pork chop soup. But at least if we can get you in there, it can help. That's, to me, the biggest safety thing that we can do all around. But I think we have to, it isn't just us, but it's the whole community. And a lot of kids have big problems. I mean, so many have a mental health problem. So the one thing we can try to do is to get them into some kind of mental health program.
So Dr. Jordan, I think Dr. Hines, you had a comment on this point also.
So I will be very transparent. So I've had a lot of personal challenges in the last few months, and I was at a family gathering, and one of my family members was like, what's going on? You've been eating your feelings, which was their way of saying you're putting on weight, right? Which luckily I come from a family that I know that the comment was made in love, right? Like, but that person was also willing to then sit down with me and talk to me about what's going on, right? So, and giving that example, what I'm saying is, it's fine to acknowledge, right? But then the next thing is, are you willing to talk with somebody about what's going on that may be showing up as their substance abuse problem, as they're eating or overweight or those kinds of things? Next one, like, are you willing to go walk with them, right? Are you willing to go exercise with them? And that's another thing that then came out of that conversation, right? Like, oh, you want to set up a time to go meet on Tuesdays to go walk? You know what? That works for me. Like, we'll put it on the calendar. Let's mark it down right now. It's one thing to talk about. It's one thing to talk and to acknowledge. Because here's the other thing, especially when you're talking about things that people know. People with substance abuse problems, they know, right? People who are overweight, they know. You're not saying anything novel. Whether whatever the number is on the scale, they already knew. They walk with themselves, live with themselves every day. But if we're talking, especially in how we can relate to our friends and family members and loved ones, if you're put your comment with an action, right? That says, how can I help? Right? Is there something that I can do to support you? Right? Those are things that I think that we can all do, even as a physician. For my folks that have some of those challenges, what are the things that we can do to help, whether or not is refer to counseling services or those kinds of things? Like there's the comment, and then there's whatever comes after that can be actually helpful. One of the things that I will also say about the before times, this period during COVID there are lots of movements that have taken place, not necessarily specific to health directly, but in Black History Month, the theme for this year's Black History Month is Black health and wellness, right? Like we have an opportunity here that I think that we haven't necessarily had in a while, in my opinion, to value ourselves, right? Mm-hmm. To decide to have some self-worth, because a lot of the things that we're talking about, the vigilance that we're talking about, the changing of habits that we're talking about, a lot of these things have come up in the last 2 years of things that are of importance to our communities and things that should be important to us as individuals, whether for ourselves or for our children. These are discussions that we weren't necessarily having 2 years ago, right? Even in your workplace spaces, initiatives on, diversity, equity, inclusion, the health equity issues, these are conversations that were not taking place on this level 2-3 years ago. So when we talk about, how we go forward and being on our own, I think one of the things is we have to seize that opportunity to see our value and to see our worth as an individual and as a people. And once we kind of do that, I think that will help spur some of the other changes that can then need to take place.
I really like those comments, especially the ones that you spoke about of how we address each other and make an action plan. That ought to be the subject of one of our programs, Dr. Hines, in the future, about how we deal with these problems amongst our family members and friends without shaming them or wiping them out, but also making sure that we help in a positive way save their lives. That's excellent. I want to call on, I know we're going to close shortly, but we have a few people I'd like to hear from briefly. One is Dr. Dawes, if she's on. Is Dr. Lisa Dawes on? And there's Dr. Rhonda Johnson. Is Dr. Rhonda on?
I don't see Dr. Lisa, Randall.
Yes, Dr. Maxey, I am here.
How are you? I'd love you to just join our topic for a moment. You have a lot of wisdom.
Hello. I don't know about that.
We know.
Hello, everyone.
Hello.
We're all over the place, so I'm not sure what you want me to join in on, Dr. Maxey.
Well, we were talking about, because of the recent lowering of some mandates and protections of people at work and in school and at home, and because of economic concerns, that we're telling people that they have to be more of an advocate for their family and themselves, and they may be forced to or encouraged to go to work in a place that's unsafe for them. And they have to have some personal common sense and advocacy on how to protect their families during this period of time. The other thought that was raised, because of many of us have body habitus, we have diabetes, we have obesity, and we may have somewhat of a decreased immune system. So how do we stay safe in this changing world of the United States? I won't speak about the world yet.
Okay, well, I'll speak from a person who does a lot of education on social media. And this is what I have learned. I do a lot of education through all the social media channels, YouTube, Facebook, Instagram, and TikTok. What I have really learned from this is that you have to constantly remind people of the basics. because we're in a pandemic that has been so polarized around the vaccines in particular, people have forgotten, I'm only speaking from my anecdotal experience. People have forgotten that it's the virus that's really the enemy here. And so what I have decided that I could do to try to make a contribution is just to keep the focus on the virus and the effects of the virus, on the pediatric population, on the adult population, focusing on education around long COVID, focusing on just primary prevention of getting COVID and what to do if you get COVID. I have found there is such a huge gap in information about the basics. So I still think there is a need for continued education. I do think that there are a lot of immunocompromised people out there. And I do think that a lot of people will voluntarily continue to wear masks. These are some of the worried, but there are people, this is what I have learned in my 3 years almost of doing education. There are people that just are not going to be moved to get vaccinated, period. They're just not. They are going to continue to refuse getting vaccinated. And, the rolling back of the mandates, this is only going, I think we're in trouble here. I think the public health community is in trouble. I think doctors, through all of these, we have to remember too, we have just as many medical people telling people things that are totally different than what we're telling them. We have doctors that are telling people not to get vaccinated. We have nurses that are telling people not to get vaccinated. So who can the public really trust and believe? There's a lot of confusion. There's so much misinformation. So what I have found, what I've just feel that it's worthwhile for me to do is just to keep emphasizing the basics. Just keep presenting the facts, keep trying to make the science more intelligible to ordinary lay people, something Dr. Watts talks about all the time, and just continue to do what we do, realizing that we may be having an impact that's far beyond what we can see. And just don't give up hope. I say just stay focused on what we know to be the truth. I'm never into body shaming because again, we have a lot of challenges in our community. The things that we live through every single day would break other people.
Yes.
Yet our kids go to school. I used to do a lot of work in the schools, and you'd ask them how many people, even in elementary school, second, third grade, have a family member know somebody who's been shot. How many people have witnessed somebody get shot? How many people know somebody who has HIV/AIDS? And all the hands in the room go up. We have a major problem here in our community. So, anything that we can do to engage, uplift, encourage, make access truly available to people in their communities, where they live, work, and play. I think that's what's important. I know I'm giving very general answers.
And those are very wise answers, and certainly appreciate you.
Yes.
Is Dr. Dawes on or Dr. Walks?
I do not see Dr. Dawes, Dr. Maxey.
Okay, I'd like a brief comment if he's available from Dr. Steiner, and then we're going to move towards closing.
Okay, thank you, Dr. Maxey, and hello to everybody. Ken Steiner here. I have two things to say briefly. One is I found myself in practice, this is such a caring group, such an educated and caring group. And I'm sure many of the physicians here have found themselves in a position where they say to their patient, there's something wrong when I care more than you care. And that's what we're seeing now. We're seeing that we care more than our patients care, many of them. So it's always been an obstacle for me to try and get around that. And I've tried to speak to patients about that. And I always use that statement, there's something wrong here when I care more than you care. And that seems to break the ice pretty well for me. So I wanted to share that. And then the second thing I wanted to share briefly was let's all get a plan. You know, I spoke about this a few weeks ago. I think we need a plan for ourselves about how we're going forward into this next phase of COVID and just what we're going to do. And if we do get struck with COVID, how we're going to handle it and have a plan to move forward with. And I think that's a great topic for discussion down the road. What is our plan on this new phase? So thank you for having me today, Dr. Maxine. Good to see you in good health, back where you should be. Thank you.
Thank you so much. So we're at our time. We need to bring our program to a close. I'd like to ask the moderators to add a final comment if they have one, starting with Dr. Hines.
I would just say, not to steal Dr. Walks's thunder, but we're not on our own. We're God's still with us, right?
Amen.
Yeah, and we're gonna go forward with some faith and making good, intelligent decisions.
Thank you so much. Dr. Walks?
I want to just do a couple of things real quick. The first one is I want to acknowledge that that tomorrow's Valentine's Day, and it's as good a time as any to decide that we're going to love ourselves, and we're going to take better care of ourselves, and we're going to be kind to the people that we meet. We're going to say things to them in a way that is useful. I like to say, don't give people information they can't use in a positive way. There are a lot of ways for us to say things to people. And what Dr. Hines said earlier about talking with folks in a way that gets something done, that gets them to move in a certain way, it's just wonderful. And the last point I'll make is, I think it would be a good idea for us to spend some time on the Black Health Trust with some of these issues of how we communicate. Where I grew up, we would talk to each other any kind of way. We would say any kind of things, and it was just funny. And you know what? Sometimes it's not funny. Sometimes we get a little bit older and we continue to talk the way we talked when we were young. And I don't want us to stop being who we are. I don't ever want to forget where I came from and how I grew up. And I think I can preserve that and up my kindness quotient as I'm talking to people and as I'm talking about people. So I would just say, it's Valentine's Day. Be kind, starting with yourself and to all the people around you.
Yeah. I think we called that, back in my day, we had these capping sessions and they were brutal. And I look back on those, I don't know if I could handle those anymore. Dr. Neighbor Stevens.
Well, I'd like to end by referring back to some remarks I made several weeks ago when I announced that and provided the website address for the free rapid antigen tests that the government was making available. So I just want to report that mine came this week. So I would encourage you to, if you haven't already, order your rapid antigen test. It's part of what you're going to need as we move forward.
And very quickly remind people what the rapid antigen is versus the PCR.
The rapid antigen test is the one that they stick this Q-tip up your nose, and the results are usually available within 15 or 20 minutes.
And the PCR?
PCR is a much more sophisticated test and requires 2 or 3 days for the test to be run. You can consider it a confirmatory test because it looks for evidence of antigen fragments of the virus.
So one is an antibody test, which can be long lasting even after you're not infectious, and one is an antigen test. Is that correct?
Correct.
Okay.
Dr. Maxey, can I I forgot, I wanted to say this earlier, just very, very quickly. Because our theme is sort of on our own and don't panic, reduce anxiety and what have you. One of the ways that I've done that several weeks ago we had Dr. Despani on with Mr. Dorsey talking about some technology that was available for folks to be able to, COVID can stay in the air for hours, as I understand it, and to just kind of make sure your space has a little bit better. I know there may be some other technologies as well, but I have a couple of Mr. Dorsey's, the machines, and I've been very happy. Ain't got COVID, so something's working. So I think it's just important to know that in addition to the hand washing and all the other things that we do as we're using common sense, that technology and science are moving forward in ways that can help us as well. I noticed that Mr. Dorsey's information was put into the chat this afternoon also.
Thank you. And I bought one. I have a brand new grandchild in Washington, D.C. who stole my wife away from me. And I put a machine in his house to protect him. So maybe I'll get to see my wife before he gets married at some point. Next week, we're going to be treated with a program consistent with Black History Month. Dr. Richard Williams, who is one of our internal legends, is going to bring a program and speak about the legends of Black health and some of our accomplished Black physicians, along with our regular updates, and we're looking forward to that. I want everybody to enjoy the Super Bowl today, which the Cincinnati Bengals are predicted to win by 4 points, according to our technician, Simon.
They are not. Come on. The Black Health Trust should be known for good information. The Rams are going to win. Just stop it. The Rams are going to win.
Well, I have it from vetted information, but and since Pastor Pointer is not here, I'm going to ask Assistant Pastor Walks to lead us in a brief word of prayer.
I'm not an assistant pastor, but I'm always happy to pray. Let's pray. Heavenly Father, Lord, we just thank you. We thank you, first of all, for being there and for letting us know you're there. What a wonderful thing to know that we are not alone. What a wonderful thing to know that our help is just a moment away and all we have to do is ask for it. So as we go through this day, we thank you. We thank you for all the plans you have for us, for all of the just winning things that you have before us. And all we have to do is have faith and keep moving forward until we bump into them. You have them on the road in front of us. We just have to never give up and keep moving forward. So with the spirit of triumph, with the spirit of confidence, and with caring and kindness, we move forward, thanking you. We pray in Jesus' name, amen.
Amen. Everybody have a good day and bless both the Bengals and the Rams. Amen.
Amen.
Have a good day.
Bye, y'all.